Hello everyone, welcome to the new episode of Borderless, RGB Live's first ever entirely English program. This week, we will be talking to the United States. Let's see what's happening in New York City. Hello Selin, greetings from Istanbul. Where are you right now?
Hello Ayna, I'm in New York, in Brooklyn more specifically. Greetings from here.
How are you?
I'm great. It's a fresh Monday morning, ready to start to work soon. Feeling good. And you?
Great. I'm good as well. Well, if you're available, I have a few questions to ask of you.
Yes, of course.
Okay, thank you. So firstly, according to World Health Organization, the United States is the leading country of the coronavirus cases. Approximately 2,000 Americans show symptoms and 200,000 are infected every single day. Most people, even sometimes important people such as politicians, fail to wear masks in public. Does the government require a citizen to wear a mask everywhere, outdoors, indoors? What are the exact measurements? Also, are there any precise action taken in order to keep the social distance?
Yeah, so it's a great question, and it's a little bit more complex system when compared to, for example, Turkey, because there is two levels of governments in the US. That's why it's the United States. There is the federal law, which has the federal regulations, leadership, authority, and then there's state laws, state governments that have different levels of power and access, etc. So in the federal government, which is like, if you can think of it like the hat that's covering all 50 states, there is no law right now that is requiring for any kind of protection. However, there is an organization called CDC, Center for Disease Control, that has been the forefront of how America deals with this pandemic. And they do recommend everyone to wear a face covering or a mask when they cannot sustain 6 feet distance from each other. And 6 feet is about 2 meters distance. Especially when you're in indoor space, they do recommend. It is not a law. So on the state level, certain states have passed it as a law recently, like New York definitely has. New Hampshire, I think, did it 2 weeks ago, where it is required to put a mask on or like have a face covering when you cannot maintain the 6 feet distance. And it depends if you're 2 to 12 years of age or older. It, again, depends on which states determined on what kind of age group, but there is some sort of like kind of control or amendment happening. In terms of the politicians, the current president Trump does not believe in science, so it is very hard for him to wear a mask, to accept the virus is protected or is blocked by a mask, etc. Everything that Dr. Fauci, who's like a doctor, and he's the director of a very well-known organization, and for decades has been guiding presidents on these kind of matters. He's been in constant battles and arguments with Dr. Fauci. So it is not surprising to see that the political leaders, some political leaders, are not really wearing these masks. But if you look at like Governor Cuomo, for example, who's the governor of New York State, he's appeared with a mask in every press release. So he does really understand and follow the recommendations by CDC. So you can see a difference. Unfortunately, it is political at this point too, ways that it has taken. But yeah, so that's kind of where the different states stand in order to try to protect the Americans. And yeah, hopefully the numbers will decrease. That's what we're wishing for.
We all hope for that, everywhere, anywhere.
Yeah, exactly.
Moving on. I have another question for you. It is well known all around the world that the healthcare system in the States is very expensive. And how does the system handle the infected? How are the hospitals? What's up with the ICUs? And is America taking enough action when it comes to the treatment of an infected individual?
So yeah, I mean, in the States, because it's very capitalistic driven in every area, as well as healthcare, there is no public healthcare, or there is very limited. So there is Medicare, which is for individuals that are 65 years of age or older. And there is Medicaid, which is for very low income people. And it depends on states, again, regulations, whether you qualify or not. But apart from these two, there's nothing really that's like public or government or federal backed insurances. So it's at pretty much everyone's own expense to meet the bills of the hospitals. And it is super expensive. To give you a reference, like I'm also an American citizen, so I clearly have no access to public health insurance. And I ended up in a hospital like for 5 hours because of like some issues, nothing too serious, but I got checked, etc. And the bill was $35,000 for being in a hospital for 4 hours.
Oh my God.
So yeah, and it was not COVID related, but just to give you a general idea of what the bills look like, and it's very hard for Americans to afford this. So there is like, Obama has established something there, the Affordable Care Act, which again, President Trump has been trying to get Supreme Court to rule against, but Biden, who's the president-elect, who will take office January 20 and onwards, is looking to build on that. His first and most like loud message was to make American healthcare system stronger and more affordable for every American, not just the very low income or the elderly. So we should hopefully see changes in the next years, but as of now, the government is not doing much. However, the healthcare, the equipment, the research, the doctors, they're great. It's a strong system when it comes to curing. Unfortunately, because of lack of access and the overwhelming numbers, I think there's over 230,000 deaths as of this point. But so being in New York, I can speak to New York. Like around April, we were out of hospital space. Like ICU units were, I think, 90% or more full. So they turned this convention center, Javits Center, into a hospital. They put up like tents in Central Park. They brought a Navy ship to make it a hospital. So New Yorkers are creative, and Cuomo has been fighting for a lot of funding. Again, back to the federal government and state governments. So federal government didn't have a plan, and therefore states individually made their own plans and tried to fight for equipment, PPE, and funding. And New York was the worst in the beginning of the pandemic. So it was like really fighting to get the most service or equipment out of the other when compared to the other states. And so everybody's working within a budget and etc. And right now the situation is not that bad anymore. It recovered, New York recovered very well. Now the cases are rising up a lot. But the hospitalizations, as far as I know, as like a regular citizen and not a subject matter expert, I think there is like still room and people are getting treated. Yeah, however, I can still add, like I'm talking for New York because that's where I live and what I'm very aware of. But I did travel to Florida 2 weeks ago. I went to South Florida, the Keys, which is a red state meaning they're Republican and they follow Trump's value system. And there was not a single person who had a mask on the street and indoors. You would be shocked. I wanted to go out to have a dinner and I couldn't. I was afraid because like nobody had a mask. Everybody was like hugging and singing and dancing and partying as if we're not in 2020, as if it's like 2018 still. So
yeah, as if nothing is happening.
Exactly. It was like in another world. So I think different states you go, different experiences you have with how cautious people are and how much they follow their state laws or the CDC guidelines. Yeah.
Thank you so much, Selin, for joining us and giving a great information and giving us a great perspective of what's happening in the States. I really hope everything will be better sometime soon, and I hope to see you again.
Likewise, thank you so much, Ayla, and yeah, hope everything gets better around the world, and it's a pleasure to speak with you.
Thank you. Bye-bye.
Bye.
Thank you so much, Selin, for joining us today. This was brought to you by Borderless. See you next time.